student athletes resume sports, it also comes amid the surge of the COVID Delta variant. Today we're going to hear more on what the World Health Organization says about playing sports and wearing masks. Joining us with more on this is Dr. Chad Domingue, a local neurologist with the Avila Physician Network, to talk about the risks and the benefits. Thank you so much for joining us.
Absolutely. Good afternoon. Good to see everybody.
Thank you so much for explaining this. So many parents and athletes are impacted by this. So let's look first at the benefits, but also the medical warnings as well. Let's start with the benefits of students wearing masks. What is the benefits of it that you hear from doctors and the World Health Organization?
Yeah, so let's start with the experts, right? So I'm quoting what I pulled off the internet here. So World Health Organization. Children should not wear a mask when playing sports or doing physical activities so that it doesn't compromise their breathing, right? CDC says all people engaged in high-intensity training may not be able to wear a mask if it causes breathing difficulty. The bottom line, Liz, what we're talking about is CO2 retention. When we breathe and we blow out air, we're blowing out hot air, we're blowing out CO2. So when you put a mask, especially in children or even an adult that's doing something physical, it can have an effect on the cardiovascular system. So vomiting, passing out, fainting. The problem, and I think what they're trying to juggle, is to give someone protection from a virus, you have to have masks that have a high filtration rate. But if you do that, it's harder to breathe through. So you're kind of robbing Peter to pay Paul. So if you give these kids masks that they can breathe through, it's not really giving them any protection. So you kind of see where the dilemma gets in terms of protecting these kids, but at the same time, keeping it safe and not causing them to vomit, causing them to pass out and have that CO2 retention.
Are there certain kids with certain medical conditions doing physical activity, sports in schools, that are more vulnerable to this, that you need to have extra attention paid to?
Yeah, so what you're relying on is the benefit of this, right? So wearing a mask helps these kids get used to it. So outside of sports, you get used to wearing a mask. Kids with underlying problems such as diabetes, asthma, these are kids that are going to be more at risk wearing a mask to have problems. Obviously, what they're trying to accomplish is with impact sports, high intensity, there's a lot of contact, you can't do social distancing. So what they're trying to balance is protecting the kids with a mask, because a lot of these other measures that we're taking as adults in our normal activities just can't be done on a athletic field.
Are there some masks that are better if the child has to abide by a mandate while playing sports?
So this is where it really gets interesting. So I got a couple examples. So, cloth mask, right? What exactly is a cloth mask doing? I got my Spaceballs mask here. It doesn't really provide a lot of protection. You can breathe through it, but you can just imagine these kids pulling it down the whole time, keeping it under their nose. This is a surgical mask that I would wear doing operating, but most kids, especially in a public school system, don't have access to this. Then you look at an N95 mask. Imagine trying to play a sport with this on. This gives you the highest level of protection, but I can tell you, even doing clinic, it's not easy to breathe through this. So think about South Louisiana, all this heat, running full speed, soaking wet with sweat, soaking a cloth mask that's now wet so you can't breathe through it. And I have an 8 and a 10-year-old. You can just imagine, children in the middle of their sports, bringing it down. It could lead to injuries on the field because they're messing with their mask. They're not focusing on their athletic activities. So it's just a real problem that they're trying to juggle here. And be honest with you, if you want to protect the virus, you got to go with the N95 mask. But it's just impossible to wear this doing high-level athletic activities.
So bottom line, what should schools and parents be talking about? Because you're saying at the same time, it can have a negative impact if you're physically exerting yourself, and it could lead to passing out, fainting if you're wearing those masks. How do you balance it, and what should doctors and parents be doing then as we are in sports season?
How are we going to standardize these masks? Who's paying for it? How are we going to make sure every child has the same mask? How are we going to make sure they're wearing it appropriately? There's just so many levels to this that we're just not equipped to even begin. Right. So I think this mandate makes sense in its statement, but it doesn't make sense in terms of how it's being rolled out and the effectiveness that they're trying to accomplish.
Yes, some parents may just say, I'd rather my kids wear the mask and not play sports and have them pass out. So that could be the choice for some of them. Thank you so much, Dr. Chad. Appreciate it.
Absolutely. Always a pleasure. Good to see you.